We have in the past identified certain transcription factors. So one of them is a transcription factor known as TOX, which is known to upregulate many inhibitory receptors and modulate a lot of other programs in T cells that are dysfunctional. However, we and others showed that if you knock out this one transcription factor, it didn't really improve T cell function. So in the work that I presented today, what we really did was try to focus on what happens to T cells at the very earliest time points after they get into tumors. So the idea is that if you really want to reprogram tumors, you have to kind of find the first place where they got off track from being functional to dysfunctional. And as I said up front, people have thought that this usually takes days or even weeks in tumors, and so we decided to look at the first few hours, in fact, after T cells get into tumors. And in these models that we used, which were a model of kind of late-stage liver cancer or late-stage metastatic melanoma, what we found is that the T cells actually were getting dysfunctional or sort of derailed within hours of seeing antigen, so a lot quicker than what we had anticipated. Now, what we were hoping to find is that there might be, just by looking at these really early time points, we might not see that many differences between a functional T cell versus these dysfunctional T cells, so that we could really hone in on just maybe a couple of transcription factors. And what it turned out was that there's so many different transcription factors that were actually already being dysregulated at these early time points. So we don't have one smoking gun at this point. But what we can say is that one sort of signature that we noticed in these dysfunctional T cells is that they're lacking some of the activation of inflammatory-driven transcription factors. Members of the IRF family and STAT family. And so what we actually, in some data that I presented today that hasn't been published yet, but what we're working on now, is just by providing immunization or inflammation with listeria, you can actually rescue some of this early dysfunction. So bringing in inflammation that's not provided in the tumor already.